Okay, so we finished 2 packages, the new information, and those are new information. Some of them are not a lot in Spider-Man. Some of these informations are recent. The questions are, and the kind of questions they gave you example. That means that's the way questions you're looking for. Now the third package, it starts with 2014 Nclex workshop comprehensive notes. I did this workshop one day, and those I did in that time reviewed, but I'm going over some time more that you must not only looking your question as a book, but you must know what are important questions you're going to see. Number 1, safe and effective care environment. So what is number 1 in your Nclex is safe environment, safety. Has nothing to do with the books, safe. And also what is in safety is chain of command. Are we clear? Chain of command. Always you're going with chain of command when you're taking care of your patient. And that is used when abuse is suspected legal issue. Underline the word, what is command means. If you have somebody abuse patient and you suspect patient has been abused, what do you do? Go chain of command. Are we clear? And what do you do in chain of command? Reporting. Before you go document and start doing your own work, what do you do? Is reported. Underline that word. Suspected abuse. Your questions are going to be on abuse. Older abuse, sexually abused patients are, financially abused. Are we clear? Any kind, verbal abuse, all are abuse. Nowadays, abuse definition is very big. And anything you see your patient, child, adult, son, anybody who has been abused, what do? Go on your chain of command. That's important. Then this means report up as in your nursing, second line. And then I want you to go in the last line. Failure to report is a negligence. If you didn't report it and you ignored it, what is it? Negligence. Are we clear? So very important, if anything, whatever the best answer look, report it, report to the authority, report it. Not only document, but you must report it. Next line is in Nclex where it says, you have all time. You must see time, resources, equipment, and staff need to be ideal answer. Don't think real world of nursing. So what are you looking for? Time. What are you looking here? Resources. What is resources? What is the meaning resources? What is available for your patient? Resource. Are we clear? They're going home. Are you going to use resource for your patient? Yes. Home health agency. That's a resource. So use for your patient, for your safety resource. Maybe you need a cane. Maybe you need a walker. Maybe you need a call light. Are we clear? Resources for your patient. And do not think about real whole world of nursing for the test. So what are you looking here? A reporting word, safety word, and use all resources for your patients. Are we clear? Whatever you can think is you can apply for your patient. Focus on next line, right here, right now. Underline the word potential problem are never as important as right now problem. Right now, underline the word. What are you teaching in your question? When you are taking care of your patient, what is your first problem is here? Right now problem. What is your right now problem is your diagnosis. Your patient is diabetic. Are you going to control first blood sugar and then second? So write down you are treating a patient, whatever immediate problem. Are we clear? Immediate problem. What is second? You will go on, write down the word potential problem. What is potential problem? I want to write down nursing diagnosis. Your patient is diabetic and patient is risk for amputation. Their leg, poor circulation. Are you going to take care second after you stabilize the blood sugar, the potential problem? Are we clear? So in your question, not all the time is your book question. Number 1 is any abuse. What would you do? Report it. What would you do for prevent your patient? Use all resources. You are not only the one. You may need the psychiatrist. You may need the pharmacist. You may need somebody to help you. Are we clear? So look around your question. Then I want you to go, is potential problem would come after your immediate problem. What is immediate problem is your patient diagnosis. Are we clear? Patient came with chest pain. Are you going to worry about chest pain first and worrying about the diet later? Is cut down cholesterol because of the cardiac problem? Yes. So your problem is give chest pain medication. Assess your patient. If you have anything you need, your doctor's order. Always your doctor's order to follow is your first answer. Are you going to follow the doctor's order? Yes. And then you're looking other thing, what you're going to do for your patient, and equipment, a magic closet. Magic closet means what are the other things you're going to use. So in your safety, everything is a safety. Are you going to assign in safety is your patient reporting. If your patient is abused and you don't report, are you keeping your patient safe? No, you got to report. If your patient comes in with a problem, medical problem, treat that first before you're going in a potential problem. And third thing, you remember, you use all the resources for your patient. Are we clear? Whatever you can think, they're saying call the doctor, patient needs this, patient is going home. What is your priority? Maybe arranging home health, maybe social service need to add. See, your question, you got to think around your question. Second thing is assignment. You are admitting a patient. Are you going to have your patient safe by assignment giving CNA? Are you going to assign other nurses to help you? Yes. Assignment. What is in assignment? We already talked about. Underline the word RN. RN do assessment, immediate admission, transfer, delegation. LVN, you go stable patient. AIDS, you have UAP. Give them vital sign, stable word, unchanging procedure. And because only if RN can do teaching, only RN can do on admission and discharge. So skip on aid and then go RN, all your teaching. CNA also stable patient. You can give them vital sign, feeding. So remember, don't assign. Safety is proper assignment. So remember the word. If they give you a question, they're going to ask you, who do you assign? That's your safety question. You cannot assign something who you should do it and you're assigning CNA. Are we clear? Because that includes your safety. That's why they're considered. 5 rights of delegation and can be unlicensed assistive, unlicensed UAP, toileting, yes, ambulation, turning is okay, bathing is okay, counting your INO. Calculating means they're telling you and maintaining INO, how much patient drank. Are we clear? So they're helping you, but you're legally writing, but aren't they going to tell you how much patient drank 4 glasses of water, or intake was in 7 to 3, my patient drank about 700 cc. Are we clear? So CNA, can they help you to do that? Read your question carefully. But who is legally responsible maintaining and following doctor's order? LVN. Okay? Now, delegation is, we already talked about in the second paragraph, is RN and LVN, stable patients, you go nursing assistant, unchanging procedure. And Nclex is care, phone numbers you know, that you want to know, you can do it in this situation, which will impact the patient. Now leave those lines, but next one, you will go ensure patient safety. Another patient safety question, float. Now, if they give you a question, you are floating and you never worked in that area and you are the one nurse who's assigned. First thing, never walk out from your job. Are we clear? Because if you say, I never worked here, you give me orientation, I'm not going to go, they will not accept. Are we clear? Now, yes, it is very important for management to train you before they float you. But if there is a question, you went today to work and you are asked to float on OB and you never worked in maternity unit, what would you do? Just go and do the assignment where you feel comfortable. Something you don't know in OB, what is some procedure, you let them know that I'm not comfortable and ask them to give you orientation. So when do you make mistake? When you're floating. Are we clear? But float time, it says here, avoid unit specific skill. Avoid some special skill in that unit because you have never done. And like a death and the prognosis for chemo, treatment option. Float nurse should request orientation. Underline the word, you request. I would like to get orientation to know. But yes, if you go on a job and they assign you, don't walk out. Just do the best of your knowledge. LVN skills are transferable, but transfer LVN should perform only skill where competency has been demonstrated. Are we clear? Now what is the meaning, very important competency word for your exam. What is the word competency? You are competent to do, right? You have learned how to give medication. You have learned how to give injection. You have learned how to put Foley catheter. If you are going in a unit, are you comfortable to do vital sign? Yeah. Are you comfortable to give medication, oral? Yes. Are you comfortable to change the positioning? Yes. Are you comfortable to do simple dressing? Yes. Are you comfortable to give enema? Yes. You have never worked taking care of a newborn baby and you have never floated there and you're not comfortable that procedure, you can ask them, I'm not comfortable. Don't just jump and do things which you have not done. Are we clear? But you have been skilled, you have been taught that you are standard of care. So questions are, when you're floating, just do what is in your scope of practice. What you have not done, you request them to help you or give orientation. Are we clear? So that's important in your question. Next is transfer LVN, assigned stable patient. We already talked about. Underline the word predictable outcome. What is predictable word? Very word competency. Now, let me tell you, in the hospital and nursing home, even you have a license, the state requiring that you do competency test. So your staff developer, your people who are keeping you in job every 6 months or every 1 year, they check your skills. How did you put Foley catheter? How do you do INO? How did you do suction? So what is the word is called? Review competency. Some nurses don't know. How do you know everybody are comfortable to do the procedure? So what is important here, when your competency means you are competent to do the procedure. In another word, your jobs are required to do what test? Competency test. So now when you're going for a job, people are taking a test. Don't want to be sure whether you really, you know you are LVN, you know, but they're checking, can you really function properly? Even a lot of hospital, their staff developer, educational people, they go and do yearly test on competency skills. What is the word is called? Competency skill. So remember, if they give you review competency skill is important. Therapeutic communication is very important for nurse, for your safety. How do you talk to your patient? So not all your questions about it, your questions are reporting, working together, assignment, competency is important word, and therapeutic communication. How do you talk to your patient? Therapeutic. Remember the wording. And in interaction with family, staff member, doctors, other department. Very important, your skills of communication. Very important how to communicate. Reporting change of condition, use therapeutic communication. Give fact in a way, provide information without alarming. Don't give your, underline the word, opinion and judgment. Don't say, I think patient has pneumonia. Are we clear? You diagnosed. What do you tell? Patient has been coughing. Patient, I hear some crackles. I call the doctor. Are we clear? Don't say patient has pneumonia and I did call the doctor. You're not making a diagnosis. What are you saying? objective, symptom measurable. So don't make your communication, don't tell the family member, oh, I think your mom has pneumonia, until you have diagnosed. Are we clear? So communication is very important. And underline the word, don't give option and judgment. Tell what happened, how did this, and how did they respond. When you give pain medication, your patient is responding. What does patient look? So remember, sexual harassment is frequently tested. Do not confront. Do not look in accused past. You must take action. Know your policy. Somebody has sexual harassment, maybe employee, maybe your patient. Are we clear? So don't just go and say, oh, I think I heard that you have some allegation about sexual harassment. Don't explore that, but be careful. Monitor that patient. What is he doing? What is he can be dangerous to the person. Are we clear? And so remember, know your policy about what? Sexual harassment. Nowadays, we are very high on sexual harassment. Even staff to staff, staff to patient. How do you talk? What word are you using? How do you touch your patient? Where did you touch your person? Be very careful in sexual harassment. Review proper documentation guideline for suspected abuse. So you must know your policy for abuse, reporting, sexual harassment question. Competency is very important. Next page I will be moving is perfect choice. Best answer you give them on those questions. Issue another nurse as a staff nurse, and you would report it a person above you. So if you have another nurse, your co-worker, LVN to LVN problem, what do? Charge nurse, supervisor, report it. Don't go yourself. Why? Because a lot of times when you're dealing with them can be a problem. So what do? You report it. It's best. Now some book says if there is some little problem like in your counting, you question them, ask them. But if you really see a problem, always is better to report it. Are we clear? To the, maybe the DON manager, go chain of command, underline. Do not check the patient and do not confront the nurse assigned to that patient. Now you do not get involved. Why did you do for this patient? Why did you do that? And why I saw this and you should have not done. So remember the word, what do you see? Any question, the best answer is what? Report it. Are we clear? Now, somebody or CNA is doing, family member is doing, other co-worker is doing, you must report it. Underline the word documentation. Are you going to review your documentation? Yes, for your Nclex. I want you to write down on documentation objective and subjective. So they are going to phrase the word. And they're going to say your patient is doing this. And what would you document? So write down the word objective. What did you see in your patient? Subjective. What patient said? In objective can be your vital sign. What did you object? Urine output. Maybe they're vomiting. Can be. And also patient. Now don't say objective. Patient is depressed. How do you know patient is depressed? Refuse to get up. Patient, don't say patient is depressed, that's a diagnosis. So what do you say? Objective. You went in patient's room, the light is turned off, the curtains were not pulled, patient is not eating, and patient is refusing to get up from the bed. Are we clear? Patient says no family member is visiting me. And patient stated in subjective, I feel depressed. Who stated here? Patient. Are we clear? Now maybe you can say appears to be depressed, but don't say patient is depressed and you didn't write any of those information. And they're going to throw the scenario. They're checking. Anytime whatever patient tells you, you must document. Whatever you go and see in the room, you must document. You went in the patient room. IV was laying on the bed. Are you going to document that? Where did you find the IV on the bed? Yes. And patient stated, I pulled out the IV, it's bothering me. Now you will say, yes, you notify the doctor and the RN, but are you going to document where did you find the IV? Yes. And one question, they have built that question and said, notify doctor, document and restart IV. What do you do in your documentation? You've got to document what did you see when you went in the room, the IV was laying on the bed, patient pulled out the IV, you observe. So remember, all your documentation must be fact. And how do you do fact, objective and subjective? If you will understand your theme of your question, you will do better. Next is temporary agency. What is next paragraph? Error. What do you do? Find error. And also incident. Remember the word medication error. And patient has incident. What is your first priority? What is your first priority if you have medication error and your patient fell? That's an incident. What do you do first thing? Stay with your patient and assess. Never leave your patient alone. That's a priority. So what do you do first thing? Assess your patient and stay with your patient. Patient looks stable. Then you put the patient and then you go, you document an incident report. Everyone is okay. What do you do on incident? Incident report, but stay with your patient. And third thing I want you to add there, write down the care plan and prevent from incident. How? Come up with the care plan and continue charting at least for 72 hours. You observe your patient. Aren't you going to continue observing? Yes. Are we clear? So every nursing home and hospital, these are called everyday charting. Your new admission charting, any incident charting, any medication error charting. So everyone should know what do you do. Next line, temporary agency. What is temporary agency? You're working through the registry. They are same employee as your hospital. Temporary agency, they're responsible and they have like a full staff. Underline the word, like a regular staff. They should do all the work, what you are doing. So underline that. And also their skills, same. Do not need a light assignment. You don't need to give them light assignment. You have somebody who's coming from registry. They get the same patient, they get the same work to do. Do not require resource person. You don't need to provide a person to help them. They should know what they are doing. There is no reason to check on float. If there was a float available, you would have them. Are we clear? So float person is coming in your unit, they're same equal what you are. If your registry is coming in, they're totally responsible for their job. Are we clear? So that's their job and they should know. Restraint. What are the restraints are? Physical and chemical restraint. And also only use threatening word or violent in emergency. And confused patient need frequent reorientation. If they give you the word patient is confused, don't use restraint. Are we clear? What are you using for confusion? Reorientation. Patient has Alzheimer. Are you going to restrain them? No. Safety. See, you got to read the question all the time. Don't take a patient is becoming confused, you tie them up. No. And also, I want you to write down on the side. I have talked about that. Less restrictive measures. Less restrictive measure. Don't get a restraint, but what do you do? They will say less restrictive. Maybe 1-in-1. Are we clear? Maybe a special bed. Patient is falling, lower bed. Are we clear? So don't go on a jumping in a restraint question. What do? Your patient is confused, restrain them. Maybe your answer reorientation. Maybe take them to the bathroom. Maybe they're looking for the bathroom. So see how your questions are. You got to read very carefully. So do not pick up your answer for restraint. Next is review teaching patient. Underline the word ready to learn. Patient is going home. What would you teach patient? First thing, patient has to be ready to learn. You must adjust your teaching according to patient need and respect and fear and adjust teaching plan and their needs. Are we clear? So what is important? Don't say, I will teach the patient. What do you teach the patient in teaching question? Number one, when you are teaching them, I would like any procedure they give you, patient is going home with G-tube, insulin, injection, dressing. How do you teach them? Your answer would be demonstration. What do you do? Show them. Are we clear? If you are not demonstrating, don't say, I will give a piece of paper, I will let them show the video. What are you doing? Demonstrating. How do you know your patient understand? Then your answer would be what? Re-demonstration. How do you know your patient knows how to give injection? Can you show me how do you draw the insulin? Are we clear? How are you going to give? Where are you going to give? What do you need when you're giving injection? First thing, patient is ready to learn. Can you teach somebody who doesn't want to learn? No. So remember, one answer, ready to learn. I am giving you all options. Number two, know how much patient already know. How much patient has knowledge. So if a diabetic patient for 10 years, I'm not going to say, I'm going to tell you about diabetes. They already know for 10 years, right? So what do I ask them? Tell me, what do you know how to give your insulin? Do you need any help? Do you know how to choose your food? So patient says, well, I'm not comfortable about choosing my food. So here you need to teach. Are we clear? Do you know your foot care? Yes, I know foot care. I know I'll get sore. All right, what do you do? So what are you testing? How much they know. Don't just start, I'm teaching you about diabetic. Diabetes comes here, and diabetic need insulin, and diabetic need this. They already know a lot of things. So where do you add? Where they need help. Are they ready to learn? These are your questions, believe me or not. You got to read your question. And next thing, a patient is going home. How do you teach them give insulin? By demonstration. How do you give them G-tube feeding? Demonstration. How do you teach them giving wound care? Demonstration. How do you know your patient understand your teaching? What do you ask your patient? Return demonstration. Ask the question. And remember, first thing, they are ready to learn. You go and say, patient says, I'm here to teach you. And patient says, I really don't care you teach me. I already know. Are they going to learn from you? Okay, sir, what else do you want? I can help you. Are we clear? Offer your help wherever they need. Your questions are like this in exam. So you are giving those answers. So that's good. Next is simple information required translator. Somebody doesn't know in your question and they don't speak language, get somebody translator. Your consent, teaching them going home. You cannot teach them if they don't understand English. Are we clear? Get somebody who can teach them. Very important is next is review teaching patient, we did already, and required translator. Seizure precaution, teaching. Yes, use, they don't bite, airways, side rails, very important, and mattress may be placed on the floor. Why? If they fell, then there. Very important in seizure question, legal liabilities. Call light in reach, one of your question in Lippincott. Patient had a seizure. How do you know you comply with liability question? You call the answer light. Answer the call light. Because if you don't have call light in reach, how is your patient is going to call? Are we clear? So seizure precaution comes in exam. Then I will go underneath age appropriate. You got to give teaching according to age, especially in children, toddler, preschool, school age. Are we clear? So make sure we have talked enough about that. Older people, confused patient, Alzheimer patients. You cannot teach what you're teaching to a regular person. Your teaching would be different. And age is very important. Underline the word advanced directive. When do you check advanced directive? On admission. And share with the doctor. Advanced directives are written instruction convey his wishes to medical treatment, underline that word, and whose wishes can no longer be personally communicated. What does it mean, Klein, underline the word advocate? Who are we for our patients? Nurses are advocate. Are we clear? We are taking care of our patient. So for language, anything you need help, you're advocate. Advocacy is most important role of a nurse. So they ask you, what are you working for your patient as an advocate? Are we clear? What are you preventing your patient here from fall, from any kind of mistreatment is? Any assistance you will give them. Decision making, you can help them. So remember the word advocacy. Are we clear? We are advocate for our patient. Now those are important wording and understanding. Next is what concept the nurse should consider priority care. Underline the word acute versus chronic. Exacerbated word is a chronic word. So which is the one is bad here? Underline the word acute and exacerbated. Chronic you can wait. Acute you got to treat according to your acute patient. Ask yourself, will patient make it through this shift? Answer based on what would you do for your patient immediate need. Everyone in your question. Patient has acute fever. Patient has acute respiratory distress. Patient has acute asthma. Patient has acute multiple sclerosis. All your patients must be treated immediately because they are acute. And the best answer all the time are for your patient rest and proper airway, maybe medication. Always remember, exclamation word is important, acute word is important. Next, I would go on, durable power of your patient healthcare is called health proxy, underline individual delegated for your patient on living will. Living will is also same as endurable power. Patient made decision to make someone in charge. Everyone should understand this wording. Legal issue, informed consent. Withdraw consent at any time. Can patient take away the consent anytime? Yes. And follow that. Informed consent is required. Consent is required, underline, for your treatment before you give your treatment. Understand the language, your patient, before they sign consent, and before you, and facility policy and state law. I want you write down the word competent word. We already talked this before. Your patient is competent. And your doctor will write down competency, yes or no. If doctor said patient is competent, number one. Number two, language. Your patient understands language. Number three, is your benefits and is harm. What can cause harm to your patient or what benefit is with the treatment? You must explain to your patient. And they're not influence of any drugs. Remember, language. And number four, they're not under influence of your sleeping pill, Ativan, when you're getting consent. So they might throw the scenario and they're saying patient had sleeping pill last night. Patient has been competent and patient is still sleepy. Are you going to get the consent? No. If your patient cannot understand the language, can you get the consent? No. Are you explaining benefits and also what are the patient can have advantage and disadvantage with this procedure? You must know. So everyone, your questions are going to be on consent. Are we clear? So if you do find it, this is the way you answer. You must sign separate informed consent for each procedure. Underline that word. If you're going to apply restraint, wrist restraint, and you're going to get now body restraint, are you going to get separate consent? Yes. You're giving a chemical restraint, are you going to get that? Patient is going for surgery, are you going to get that? It's a surgical consent. Are we clear? Each procedure need a separate consent. Are we okay? You don't use one. Next is, before signing consent, you should know the treatment option available for your patient, and pre and intraoperative, postoperative phase. Underline the word risk involved. They must know advantage and disadvantage. The patient should have general idea about recovery, how they're going to recover after surgery. See, they will use this wording, and you've got to understand the question. Nothing has to do with the book. Then you go privacy rule for health insurance. Underline the word HIPAA. HIPAA is your privacy act. Whether you're going privacy anywhere, you make sure your patient understand the privacy rule. Are we clear? And also, you provide them the privacy for their record, procedure, talking, and that is called HIPAA, Privacy Act. Would you respond for yelling and complaining that you always get to take your lunch break first? If your patient is yelling and your patient is in pain, are you going to answer, I'm going to take a break and I'm going for lunch? No. I had people who said, I'm going on my break. You have to wait for your pain medication. Can you tell that? No, it's not good. So you got to make sure patient comes first. Are we clear? All right, so make sure. Notify supervisor. Clarify appropriate personnel and legal scope of practice, and underline the word competency. Very important that you are competent to understand your job and you understand your work. Then you will go difference between responsibility, accountability, and authority. We all should know. Nurse must transfer responsibility and performance for retain accountability for its outcome. How can the nurse can management in a resource of meeting and need of the client? How do you underline the word case management? Nowadays, we are very important case management. Well, how do you manage the patient case? Coordinate care provided, underline the word continuity of the care. What is case management? Not only when they're in the hospital, continuity of the care. Even continuity in the hospital and home. Communication between client and underline provided care, primary provider. Who is primary provider? Doctors. Make sure you communicate all the problem during their stay, so when you are assigned as a case manager, your job is to communicate between patient and the doctor. So if they give you a question, case management. That's a case management. Clarify information for primary care to the client. Patient is upset. Patient says, I don't understand why doctor gave me this medication. So primary care provider, RN or LVN, you are a case manager, check with the doctor and satisfy your patient. Are we clear? So you got to communicate between the doctors and the patient. Confusing and any kind of jargon wording. Patient is going home, underline jargon wording, medical wording. Client does not understand those jargon words. What do you give? Simple word. You are going home, you should take medicine TID. Do you tell them TID? No, 3 times a day. You take your medication HS. No, don't use terminology, simple word where they can understand. Assisting client resolve any conflict. Underline the word conflict. You are not happy. Patient is having conflict. What will be the problem? Lawsuits? How do you resolve that conflict? By resolving patient's problem with the care provider. Everyone should know these days how do we manage our patient care? Right, remember the word case management. What is case management? You're taking care of patient in the hospital, even after patient is going home, ongoing communication, even home. Make sure your patient understand. And who takes care of that? Case manager. Are we clear? So what do we have these days? Case manager. They're responsible between you and a doctor, and they call home and they will resolve. Nurses are commonly held liable for failing and accurate account of sponges and devices during surgery. Underline that word. So we got to be very careful when they are in surgery, and lawsuits regarding self-determination from state to state are different. Therefore, nurse and familiar with the law of the state. Very important you follow the law and regulation. Next page, I will move on. It says 6, malpractice is a professional and also wrongful conduct. Underline malpractice. Improper discharge, standard of care, harm to the patient are under what? Malpractice. So if your patient is going home and you have not treated your patient correctly, are you going to be legally responsible? Are we clear? Yes. If your patient is going home, are you supposed to give their medication home? Yes. Did you give correct doses? I have people who made mistake. They gave somebody else medication. They pulled out some other patient medication, put it in the bag, and they have sent them to the home. They have sent insulin, but they never gave syringes. They sent home, never gave their pain medication. Number one, you must have a doctor's order to release all the drug. Patient is going home, your teaching is responsible. What else you need to remember when your patient is going home? Are they going to follow up with the home care? Is the home care is set up? Is the bed is available at home? Don't send the patient discharge, okay, who's coming? Let them pick up the patient and gone home. Whatever happened to them when they go home, in not a proper discharge, we are responsible. We cannot throw the patient on the street. We got to make sure they're in a proper environment and the care has been taken. Rules, nurse can refuse patient care assignment. Something you do not believe. However, in the general nurse can refuse patient assignment, and most states they may refuse participate in abortion, somebody who does not practice, or something you do not believe. Let the authority know. Are we clear? Otherwise, you are legally supposed to do. That means you cannot refuse. Nurse can be found negligent if patient's injured because of failed to perform a duty, that is, underline the word reasonable and prudent manner. That come under neglect. So write down on the word neglect. What is neglect is you did not follow what you were supposed to follow in prudent manner. So if any other LVN has to do same thing but you didn't do correctly, that means it's not good. Next is Good Samaritan law. We already said you can perform and without fear of lawsuit. Remember, you give in a good faith. Remember the word good faith care, and don't ask money. You are okay. This came in question. Everyone remember, this question came. Physician should verbal and telephone order, and they ask them within the time established by facility, usually 24 hours. They ask this question, how long the doctor should sign your verbal consent and telephone consent within how many time? 24 hours. Are we clear? If they did not sign, can you follow that order? No. There was this question came. Person could not do it. They have no clue. They gave all the hours. And they asked this, and somebody who got the question, they could not do it. Are we clear? So these are the types. So telephone order is okay if they give verbal order, but those order must be signed by the physician. And for how long? Within 24 hours. If they did not sign, what does it mean? After 24 hours, those orders are, you cannot take care. You got to change that order and renew that order. Competent adult has refused life-saving medical treatment. And also refusing. Can your patient refuse who's competent for restraint, for medication, for anything? Yes. Make sure the underline the word consequences. Underline the word individual fully informed for consequence. What does it mean here? Your patient is going home and patient has pneumonia Patient is on antibiotic and patient says, I want to go home. I don't care. What do you tell them? You have pneumonia, you're on antibiotic. If you will go home and you're not taking these antibiotics, what will happen? Are we clear? Are you refusing your insulin? What will be the consequence? You're refusing. Document. Write down in the care plan. Patient is what? Non-compliance. Did you inform the consequences? Make sure you document. Now, if you didn't document it and patient died, and you said you documented, patient refused, neither you call the doctor, neither you have documented, neither you have explained consequences. What do you report to your patient? What will happen if you will refuse this? Are we clear? That is the meaning. So everyone underline the word consequences. That would be good on your question. Although patient health record or a chart, healthcare facility is a physical property, it can belong to the patient, but whose that records are hospital. Are we clear? It is a patient's record about patient, but belongs to who? The hospital and doctors. So we all know that's not a patient's property. Next is healthcare record released to third party. Somebody comes, a lawyer, and they said, we want to get the copy of this patient. Who need to sign? Patient or legal guardian must sign written consent to okay to give them the copy. Are we clear? So if the patient didn't sign consent, don't give copy to anybody. Are we clear? You got to let them know you're giving copy. That's why these days, very important, when we have students coming in and they're learning and they're making copies, they're reading, they're going out, is getting a legal. That's why a lot of hospital and think they're very careful. The student don't touch this and don't touch that, because a lot of time you invite people when you're doing catheter and 15 students are watching. That's a exposure of your patient, legal. Are we clear? Student is in the room and taking a flash thing and taking a picture of your patient. That's not correct either. You can't take without the consent. Everything is very legal. So this kind of question you're going to see has nothing to do with the book, your legality, your practice, your question. Next question. So everyone should know, when you give a copy, patient must sign a consent, right? Next line. Controlled substance. Every dose of controlled substance dispensed by the pharmacy must be accounted for, whether the dose was administered or discarded accidentally. What does it mean? Write down, document all doses. What did you do? And if you did drop it and you're destroying, what do? Have a witness. And you must have your RN involved. Are we clear? Is it other medication is okay, you have 2 LVN, you have destroyed your narcotic, make sure your RN supervisor is aware and your DON is aware, whoever is in the building. And what happened? You're missing controlled dosage. What happened? You got to report right away. You receive from pharmacy, you're not receiving correctly. Are you going to report somebody? Yes. What happened? Your box of your card and somebody punches out and take out the pill. Patient says, I don't want. What do? Don't take it back. Don't put the tape. That's a dispensing of the drug. You cannot take it back and put it back and seized. I had one time, all the narcotic card has about 15 times the tape. Big problem. We do not dispense. Your patient refuses it, it has to be destroyed, has to be given for destruction, but do not, what is it? Because you cannot dispense. And I'll tell you, some people have taken out the codeine and they put it in plain Tylenol. So when you're putting back, how are you sure what somebody is putting back in that hole? Are we clear? So remember, anytime you're a med nurse and somebody is doing that and your card and you're counting, let somebody know. I was surprised when somebody found out, and I had about 15 and 20 cards in narcotic. people have taken out, and nurses don't realize that's illegal to do it. So, and the first thing is, you know this patient refusing, ask him, I'm going to bring you a pill, are you going to take it? Patient refused it, the medication. It's okay. You got to destroy, but have someone sign it, but don't put it back. Are we clear? Whether it's a bottle, whether it's an insulin, whether it's that, once you take it out, you got to destroy it. You do not put it back. That's always in your question. So that's important, uncontrolled. A nurse perform duties violate rule of regulation, underline, of state licensing board, healthcare facility or physician, if they are authority by. Don't violate the rules and regulation of your state, your licensing, and your hospital. If you violate, you have a big problem. Minimize interrupters during patient interview. Underline the word patient interview. Private room. You want to talk to your patient. Don't talk in front of people. You want to interview about patient history and problem, take them in a separate room. Privacy, because everyone is listening. And underline that word is, maybe you have a pharmacist who want to check the patient. Provide them privacy. Somebody, other doctor comes in, provide them privacy. You don't want them to just go in the room and do not maintain privacy. Bill of Right, guidance, protection, responsibility of the hospital toward the patient. You have underlined the word patient's Bill of Right means patient right. When do you let your patient know your patient's right? Write down on their admission. Your patient comes in. What is your patient right? Means doctor, medication, visiting hours, smoking areas. Are we clear? Dietary, what your kitchen, some facility they do not serve pork. Are they your facility smoking or non-smoking? Are we clear? Any patient's right. What is your patient rights? You get paid, you get billed in so and so month. How much money will be costing? What food are we providing? What nurses are taking care? Are we clear? Everything patient right. Now think about if you don't tell the patients on admission that this facility is non-smoking and your patient is a smoker. They're going to get upset. I had a patient who eat pork. And our facility was pork. They don't cook pork. They don't allow the pork. Patient was upset. Nobody told me I cannot get any pork here. You don't cook pork here. So it's a patient's right, I'll tell you. And if what doctor is taking care? If we assign this doctor, and this is your doctor, do you want to change the doctor? Yes, patient says, I don't like this doctor. I know I had him before, and I want to change the doctor. Can they change the doctor? Yes. Are we clear? What time a TV is closed in the building? 10 o'clock. You can turn on the TV. You have a roommate who has to sleep. Or you get earplugged, something that you don't disturb your patient. But that is your regulations. Are we clear? So everyone, your patient's right should be notified on admission. What can you provide? What can patient get it and report it? Now those are very important. Next line, documentation, write down, write legible. Don't write your writing, nobody can read it. Don't sign, nobody can read your signature. This is a legal documentation. A standard abbreviation, don't make your abbreviation. We are getting very, very strict because people have made a mistake by not knowing abbreviation. So they're getting very high, only like BID, TID, HS. Don't make your own abbreviation. Check the facility, what abbreviation are we using? Are we clear? Writing should be clear. Your date and time should be clear and your signature. Now, last two lines here, the two goals of healthy people 2010 are. What is healthy is you want, underline the page, in there, all ages, whether it's a child, an adult, an older, is quality of life. What are you providing? Quality. And year of a number of years. You want them to live longer. Are we clear? So what is healthy thing we are promoting? All ages, whether it's a child, adult, old. Now don't say he's a 90 years old, we don't do anything, they're old, they're dying, right? We still do a thing to keep them comfortable, keep them what they needed. Even you're 80 years old, you have arthritis, aren't you going to teach them what they can do it and how to prevent it? Yes. So all ages. And write down the word is eliminate health problem, different segments of the population. So all age group are treated for your patients are correctly. Are we okay? Now, the next is, on the next page, is look first, answer those given. This is a very good and reminding you on the next page. If there is a issue on the nurse, yes, we already did that. I need to go back on the other way. And I'll give a break, yes, I know. Safety and infection control, very high in the exam. And TB, very important. What is a positive TB? We all should know 10 mm in millimeter and is positive. Immunocompromised 5 is positive. Are we clear? And you need to prevent TB. Isolation you should know. TB medication you should know. We talked about INH. Are we clear? Streptomycin, your drugs are. And some of the drugs we have covered. Premature rupture of membrane in your safety question is very important in OB. What is the risk of rupture of membrane? Underline the word infection. What are you preventing is here from infection. And what are you assessing? Underline the word baby and mom. What are you assessing in baby? Write down fetal heart rate and fetal distress. Mother, you are monitoring, write down also early labor. In your question, mother can go early labor and mother can also can get infection. So monitor for bleeding, monitor for early labor, and monitor for infection when the membrane has been ruptured. Let's take a break, okay? And then I'll continue.